Your leaders heard you about vector training, so we had the idea of doing some of this training live so it can be a little different, a little interactive, so we're going to cover these things. I'm just going to start with, I think I know everybody, but if you don't know me, I'm Nurse Kristie. Kleinerd, like you recline in a chair and you're a nerd. Kleinerd. That's how you say it. I don't care if you say it wrong, it's cool. So, I am your friendly nurse. We have a few more coming in. I want to start by saying before I do my official presentation, if you've got a kid that's coming every day at the same time, shoot me an email and we'll discuss if they should really come between class. I'm pretty efficient, pretty quick. I see about 80 to 100 kids a day, and I can run them through. Please encourage them to come between class. I coach them to stay in their academic space as much as possible, just like you guys do. So but if they have a known medical issue, that's completely different. Super excited about the red passes this year. That'll be helpful, I think, to keep people who need to stay with me for a long time, like our diabetics or someone who has an ongoing medical issue. I think that was a smart idea. Whoever came up with that, yay, it wasn't me, but I appreciate it. Very good. All right, sign-in sheets going around. Please sign it so you get credit, and we'll get started. As always.
Testing is doing right now. You should be on to do your train stuff. Please be sure you're
Look, we're already there. All right. All right, so we're going to talk about these things, super important, and have some videos. So these are things we're going to cover. The AED. You should know where your AED is from your room, and you should know where it is. Right now, there's one right out here on this hallway. If somebody was to drop, we could run right there and get that. The other thing I will say about AEDs and locations, you are all welcome to have my cell phone. You are all welcome to text me to ask if Susie Q really came to my desk or came to my office, but no, my phone's on my desk and I might not see it for a few minutes. But if a student or a staff member has an issue, the quickest way to get me is to hit this 3 times. It tells me where exactly you're at in the building. It sends me with my big bag that has all the good stuff that's going to help save somebody. And it makes me run like when I used to run when I did 5Ks, which I haven't done in a long time. But, so hit this 3 times. We all did it the other day. It shook, so you're familiar. But you are welcome to have my cell phone, and I appreciate that, and you're welcome to contact me, but that is not going to get me. And then if you call me on the phone, you just get me, and I don't know where you're at. So hit this 3 times. We can always cancel it if somebody is having a medical emergency. That's your fastest. And then we're going to talk about bloodborne pathogens, choking. Then we're going to talk about Epipens and Epipens safety, and then seizure first aid. So our first video is about AEDs, and it's a quick review. And if you have questions, we'll talk about it afterwards.
A save station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we all understand what to do until medical help arrives, because every second matters.
Zach, are you okay? Zach, can you hear me? Zach. Can you go call 911, tell them we have an unconscious male, and report back to me once you're done?
Yes.
Perfect, thank you. Kate, can you go grab the AED from the safe station? Do you know where it is?
Yes.
Bring it back to me once you get it.
Unusual breathing, or gasping, is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. Peel the second pad from the yellow plastic liner. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange
Stand
button
clear.
now.
All clear? Shocking now.
Shock delivered. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Keep time with the beat. No one should touch the patient. Analyzing.
Breathing.
Shock not advised.
Help's on the way, okay? I'm gonna roll you into the recovery position. Zach, you're okay.
How to use the Philips on-site AED on a child. Adult pads will be pre-installed in the AED. Check to see if you have child pads available. If child pads are not available, it is safe to use adult pads, but follow the video instructions for proper pad placement. Remove adult pads by releasing the lever at the top of the AED. Replace with the pediatric cartridge. Place one pad on the center of the chest between the nipples. Place the second pad in the center of the back between the shoulder blades. Continue to follow voice prompts until medical help arrives. Always be on the lookout for the nearest AED, and don't be afraid to use it. Keep up with your CPR and AED skills. Together, we have the power to save a life.
Method that they showed was for adult pads on a kid. In this building, it's unlikely that we would have somebody under 8 or younger, but you could in a public setting, in the gym when there's lots of folks running around. So it is safe to use the pads that are in our AEDs that are adult pads by and large. There are a few locations in our building. The top one, the top AED in the gym, I don't expect you to remember this, the concession stand, there is a set of pediatric. But in an emergency, you can use adult pads front and back sandwiched like they did. Because the risk is it may deliver a slightly more powerful electrical charge that would burn their skin. We can treat a skin burn, we can't treat dead. So let's get those AED pads on them, let's use them. That's the better option than you fumbling around saying, is there pediatric pads? Do you know where the pediatric pads are? If they're there and you're trained and you feel comfortable and confident doing that, great. If not, know that the adult pads are safe. The other thing I'll comment on is knowing where your AED is. When I get there, if you're in this building or I'm near you and I come running, if you know where the AED is, guess what? You get relieved to go get the AED. If you don't know where it is, I'm gonna go get the AED, and then you gotta keep doing CPR. So know where your AED is. That's gonna help you a lot. We're gonna call 911. If a child loses consciousness and we don't have any idea what's going on, we're gonna call 911. In this building, it's taken about 4 to 5 minutes for them to come when I've said we have an unconscious student. And I think that's great. That is not true at every school in the county. And so I'm really grateful. They're close, they're very responsive, but we're gonna start that CPR. What I love is all of our AEDs in this entire county are exactly the same. And I think they're almost, I hate to say it, dummy proof. I don't think I could even screw it up. They have, if you forget everything you ever learned, they have audio prompts that will tell you every single thing to do. They will tell you to call 911. They will tell you to analyze the heart rhythm. They will tell you the rhythm to give compressions. They will even calm you down and say, breathe, when you give breaths to the person. So use those helpful aids. I have a trainer in my office. If anybody would ever like to just go through what it sounds like, what it feels like, I'm happy to do that. But the best thing we can do is get the AED on them. Don't be afraid to get the AED. It will not shock someone who does not need a shock. So putting it on them and letting it tell you how to do CPR is your greatest tool. It's dummy proof. You got somebody bossing you around. So if you go into fight, flight, or freeze that we could go into, it's going to help prompt you. So any questions about any of your AEDs or All right, inside the cabinet, if you're asked to go get the AED, bring everything in the cabinet, because there's a little bag that has the scissors to cut the shirt off. There's a bag that has a stop the bleed kit. There's all those things in there. Just bring everything. Better than going back for another trip. Like I said, it tells you everything to do. 2 ways it turns on. You either pull that pull tab, that turns it on, or you can hit the green button, either way. And we've got scissors in that little bag that's connected. You can cut the shirt off, and then you're just gonna follow those prompts and bring everything in the cabinet. Bloodborne pathogens. I know you hear this stuff every year. You know why? In healthcare, we call it low volume, high acuity things. So when something we don't do very often, but it has a big impact on things, we want you to get trained every year, because we hopefully then in a crisis you'll remember it and you'll revert back to that. So I know you guys have heard this stuff, but here we go.
Protect yourself from bloodborne pathogens. Bloodborne pathogens cannot survive for extended periods outside of the body, but they can survive in bodily fluids for days or weeks. Although infection is not imminent, bloodborne pathogens can enter the body from any mucous membrane, including minor scrapes or cuts. Therefore, protecting yourself is the first step toward preventing transmission. What does it mean to protect yourself? Protecting yourself includes understanding bloodborne pathogens, where they may be, taking standard, universal precautions, following hand-washing protocols, and thinking about your actions in advance. Always think about your environment, too. An environment can be unsafe. Other employees, family members, or other events must always be considered before you begin dealing with possible bloodborne pathogen exposure. Imagine a car accident victim who has suffered severe wounds. Make sure the scene of the accident is safe before you proceed. Follow universal precautions. Universal precautions are simple. They dictate that, until proven otherwise, any bodily fluid may contain the bloodborne pathogens that could kill you. In other words, wear appropriate personal protective equipment as needed to prevent exposure, which includes the following: gloves, goggles, face shield, mask, waterproof gown, CPR mouth shields, mouth guard. What type of PPE is needed? The type of PPE depends on the unique circumstances of each case. If blood is likely to come into contact with your clothing, wear a waterproof, disposable gown. Always wear gloves, and if spurting or coughing is likely, a face shield or mask may be needed. Remember possible allergies to latex. Some people may be allergic to materials used in the manufacture of PPE. For example, a person may be allergic to latex gloves. If a person is unable to provide allergy information, default to the use of non-latex gloves to be safe. Follow hand-washing protocols. 1. Turn on the faucet to warm water. You want the water to be warm, but avoid scalding, painful temperatures. If the towel dispenser is not automatic, make sure you can access the towel without touching the towel with dirty hands. For example, the small wheel on the slide may need to be turned. 2. Wet your hands thoroughly. 3. Apply soap and work your hands into a lather vigorously. Clean all surfaces of the hands, including 2 inches up your wrists. 4. Wash under your fingernails by making a scratching motion from side to side in the palm of your opposing hand. 5. Rinse from the wrists toward the fingertips. Avoid touching the basin of the sink or any other surface while rinsing. 6. Towel off. Throw the used paper towel away. 7. Use a new towel to turn off the water. Do not use the now wet towel to turn off the water. It will provide a vehicle for pathogens to get back to your hands. 8. Use a new towel to open the door. Think before you drink. When it's break time, it can be tempting to head straight for your drink or snack. However, you should always wash your hands before ever touching something that will come into contact with your mouth. This includes food, tobacco, vaporizers, drinks, and makeup. Learn to identify biohazard symbols. Biohazard symbols indicate what type of pathogens may be present in an area. A biohazard symbol tends to have bright orange or red-orange backgrounds with letters indicating biohazard. Your workplace has specific rules regarding where biohazards may be discarded, so check with your supervisor or ECP for guidance. Never discard biohazardous waste in ordinary trash cans.
All right, pretty short and sweet, what we know. My rule, if you don't remember anything else about this, if it's not your mama, don't touch the bodily fluid. Your own mama, I'll let you have a pass. But anyone else, you need some gloves. And I know what you're thinking. Sometimes you've inadvertently come in contact with something. The likelihood for skin that has no breaks it's very unlikely that you could get something, but we still want to wash our hands as soon as possible underwater, and with soap. We want to rinse and wash really thoroughly if you did inadvertently come in contact. You're going to call a custodian if there's something with blood in it or bodily fluids. We have biohazard bags. I have them in my office, so we don't want to put anything that's potentially biohazardous in with regular trash where they could come in contact with other things. But so just, I know in this setting, I think the number one thing you could come in contact with is probably if a kid vomited. And so just get out of the area, help them get out of the area and come to me. And that's not a badge click. I have been badge clicked for vomiting. You don't have to do that. But we do want to sequester it away and get the custodians to clean it up and get rid of it as soon as possible.
Hello and welcome to Nicholas Children's Health System Learning and Development Choking Educational Video. I'm Linda. I will demonstrate how to help a child who is choking. If choking is severe, CPR may be required. What is choking? Choking means something such as food or an object has gotten stuck in the airway, preventing air from getting into the child's lungs. Choking may be mild or severe. Mild choking means that the child can cough and make sounds. If the child is coughing, let them cough. They're trying to get the object out. If you're worried at any time about the child's breathing, do not hesitate to call 911. Severe choking means the airway is completely blocked. The child may make the choking sign, such as holding his neck with his hand, one or both hands. In severe choking, the child is not able to breathe, to cough, or to speak. Your quick response to choking can save your child's life. You will need to get the object out so the child can breathe. If you think the child is choking, ask the child, "Are you choking? Are you choking?" If he nods, let them know you're going to help them. I'm going to help you. Get behind the child, reach your arms under the child's arms. Put one fist just above the child's belly button and grab that fist with your other hand. Give quick upward thrust until the object comes out and the child can breathe or cry, or until the child becomes unresponsive, like this. Let's try this together. Are you choking? Are you choking? I can help you. One fist just above the belly button, grasping the other. Continue with the upward thrust until the object comes out and the child can breathe or cry, or until the child becomes unresponsive. If the choking child is very large, you may give chest thrust instead of abdominal thrust. To give chest thrust, reach your arms under the child's arms, placing your hands on the lower half of the child's breastbone. Pull straight back until the object comes out or the child becomes unresponsive, like this. Let's try this together. For a large choking child, hands under the child's arms, hands over the lower half of the breastbone, pulling straight back until the object comes out or the child becomes unresponsive. If the child becomes unresponsive, lay the child down on a hard surface, such as the table or on the ground. Yell for help. Help, help. Someone call 911. Hey, you in the blue shirt, call 911. If you're alone, you'll need to provide 5 cycles of CPR, then call 911. Put the phone on speaker so emergency staff can guide you. Let's try this together. Place the child. Let's place him on a hard surface. Help, help, I need help in here. Somebody call 911. We will start with compressions, 30 compressions. Place the heel of one hand on the lower half of the child's breastbone. Push hard, push fast, counting out loud to a count of 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's try this together. Find our hand position, heel of one hand on the lower half of the child's breastbone, 30 compressions, counting out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now you'll have to check the airway for any objects. Head tilt, chin lift. One hand on the child's forehead, 2 fingers on the chin to tilt the head back. Check the mouth to see if you see any objects. If no objects are seen, pinch the child's nose, cover the child's mouth, and attempt to breathe. If air does not go in, you need to repeat the chest compressions. 30 compressions, lower half of the breastbone. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, checking for objects. No objects are seen. Pinch the nose, attempt to breathe. Repeat the process over and over again. 30 compressions, opening the airway, checking for objects, attempting to breathe, over and over until the child wakes up and can cough or cry, or till emergency staff arrives to help you. This completes our video on how to help a child that is choking. On behalf of all of us at Nicholas Children's Health System, we hope you found this instructional video helpful. Thanks for learning with us.
If you've ever seen someone have this thrust, I still call it the Heimlich, sorry, performed, the physics work. I mean, you're trying to force that air, you're trying to force it upward, and it's going to, that object will come flying out. It's pretty amazing how well the physics work if you do it right. So use that first. If they go unconscious, like she said, she's doing a child, that's why she's doing one hand. If you've got a kid same size as you, you're gonna do 2 hands just like we teach our regular CPR. But the thing I will note, depending whether you're doing American Heart or you're doing our other one, some protocols call for the back blows, and we teach the back blows. So you can back blow as long as they're conscious. You're gonna have them bend over and you're gonna hit that back. Gravity also works, physics and gravity, you can't beat those. And so you're gonna bang on the back, you're gonna try to get that object to come up. So biggest thing is, if you think about the compressions may not make sense to you, but there's some research that says we have enough oxygen in our bodies to last 10 to 20 minutes, even without another breath, if you circulate it well. So we want to get those compressions. We want to get that heart pumping the blood around to the vital organs, heart, head, all of those things. So think about that. That's why the compressions are going to dislodge the object, hopefully, but the compressions are also going to compress that heart and keep that oxygen flowing until we can get that airway open and get some more oxygen into the lungs. So just think about those things, and of course hit your button 3 times and we'll all come running and help you. All right, EpiPen, this is a really short video. I also have my EpiPen trainers if you want to do a little demo at the end again. Always a good thing to review.
Hi, my name is Monica. I'm here today to educate you on the use of epinephrine autoinjectors, most commonly known as EpiPens. Symptoms of an anaphylactic reaction typically a rash, swelling of the throat, difficulty swallowing, hives, low heart rate, low blood pressure, even a feeling of fainting. As soon as you recognize symptoms of an anaphylactic reaction, get your EpiPen and begin treatment as soon as possible. To use your EpiPen, get your 2-pack, open the lid, take out your EpiPen. Be sure to grasp it firmly on the barrel of the EpiPen. Don't put your hand over the top or over the bottom. Also remember, blue to the sky, orange to the thigh. Once you have a good grip on the barrel of your EpiPen, remove the blue safety lid. Extend your arm in one motion, inject into your thigh. Hold for 3 seconds, count slowly. 1, 2, 3. Pull your arm back, remove the needle. After using your first dose of epinephrine and you feel that your symptoms are resolving, still go to the emergency room. You never know when or if that reaction might return again.
We've got a great picture. EpiPens can look like any of these over here. And I think we have a student who has this one in the middle. Yes, and then we have people that also have these. These are the fancy ones that talk to you. Not everybody's insurance does those. They're really cool. I have trainers of all of these in my office. The most common one and the one that I stock here in the nurse's office are these on that side of the screen. They're super easy to use. Just like she said, blue to the sky, orange to the thigh. The needle does not come out until you hit it. I mean, you got to use a little bit of force. And then when you take it out, I always, if you were trained by me, I say count to 10. Your adrenaline's going to be pumping. Lots of epi flowing through you. So you're going to be going in faster motion than you think. And so I just say count to 10. And then you'll be fine, because the worst thing we could do is not get the epinephrine inside the person having the reaction. So when you pull it out, that needle retracts and it's safe. You can set it down, don't throw it away. EMS is gonna wanna see what you gave and when you gave. Here in this building, if we're at this point, we're calling 911. There's a couple reasons. Epi can cause some heart arrhythmias, so we want to get that person checked out and make sure their heart is now not having issues from the medication that just saved their life. But also epinephrine has a pretty short half-life, and you typically can need a second dose as that begins to wear off in 20 to 30 minutes. So we're gonna get even known kids with allergies that carry an EpiPen, that they get this done, we're still calling 911. That's not negotiable. Because we'll hear people sometimes say, oh, well, I'll come, the parent, when we call, I'm going to come get them and take them. No, in this building, we're just going to call 911 so they're monitored and we've got things on the way. So there is a new nasal epinephrine I am super excited about because it is more stable temperature-wise. And I know of one staff person at another school who has this. And so it's the same as Narcan or Baqsimi. It goes in the nostril and you push it and it works really effectively. The good selling point to it in my mind is, what do we do with EpiPens? We carry them everywhere. We leave them in a car. Well, heat destroys them, and so they really should be kept climate controlled. The nasal is much more stable in a hot environment. So if you got loved ones or yourself and you carry EpiPen, maybe ask for the nasal next time you're in that position to replace your stuff. All right. Now, last but not least, seizures. We're just going to watch a short video again. But the biggest thing, seizures can be so variable. Seizures look very different. They can be, we have some students who have absent seizures and you're going to see them staring. You have some students who walk in a circle. It can look very different than what we were probably trained years ago, that somebody's going to fall on the ground and have a convulsion. It can be very different. So you'll know, your kiddos will have a plan, you can review the plan, but just know it can look very different, and we're going to want to time those. The really big thing, all of our plans have direction from the physician about timing, and 5 minutes is generally the rule. If they're still having symptoms in 5 minutes, we need to get EMS. We need to call 911 if they're known to us. If they're not known to us to have seizures, we're going to call 911 at the beginning.
Guys, give us some room. He's having a seizure.
Get me some towels.
Okay. Stay calm. It's going to be fine. Help me get him on his side. All right, listen up, fellas. Before we practice, I want to go over a couple of things. First, I'd like to welcome back Michael. Huh? Good to have you back. We all know Michael has epilepsy, and he shared his seizure with us in the game. He has something he wants to say.
Yeah, thank you all for supporting me, and thanks to Coach for knowing what to do. I'm sorry if my seizure scared you guys. It could be scary for me too. But what's even more scary is if people didn't know what to do.
So today, we are going to learn seizure first aid thanks to the Epilepsy Foundation. We're teammates, right? We take care of one another, we count on one another, and when anyone with epilepsy has a seizure in front of you, they're your teammate. And they're counting on you. So, first, stay with him. Okay, stay calm and keep others around you calm and out of the way. Protect him, keep him safe. It's also important to remember that the person having the seizure should be lying down and that there is nothing harmful in their way. Turn them on their side and support their head so that they're not banging it and so they don't choke. Never put anything in their mouths and do not hold them down. Time the seizure till the very end. Okay? Knowing how long the seizure lasts is important information for the doctors to know. If the seizure lasts more than 5 minutes, call 911. When you see somebody having a seizure, you're going to feel a little powerless. But if you protect them and if you stick with them by their side, you're doing the right thing. Okay? All right, let's practice this.
Bulldogs on 3. 1, 2, 3. Bulldogs! Go.
Okay, so just like you talked about, we're going to protect them. We're going to roll them on their side so if there are secretions coming out, they're not going to get into their lungs and they aspirate. So that's just the turning them on the side. But mostly just protecting their head and neck and making sure they're not hurting themselves. Again, it seems like the longest 5 minutes of your entire life. Check the time. I mean, someone try to look at the time. It's really important for if someone's a known epileptic, they track all of this, and changes in frequency and changes in length mean they could be something changing. They need to go back to the doctor. So it's important for them to know. But it's also, if it's longer than 5 minutes, we really need to get EMS involved and we need to get them engaged and on the way. But again, I think that by this time in life, we all know not to put anything in their mouth, not to try to restrain them, let them move, but just keep them safe. All right. Questions, comments, commentaries. I see a lot of nosebleeds, so I'm happy to take care of that. Yes, yes. Yeah, I just would say that I get a lot of frequent flyers. I'll give you a short story. Last year I had a girl every day 5 minutes before the last bell, and I finally sent her teacher a note and said, I'm happy to see her 5 minutes for a headache every single day, but I really, if this is disruptive to your class, I'm here until 3 o'clock. She can come when the bell rings. And he was like, oh, it is a little disruptive, and she was super pleasant about it. But when we made that change, I never saw her again. She was getting Tylenol every day. So we saved her liver, and I think she was just trying to get to the parking lot earlier. But it's things like that I say, if you've got somebody who's constantly coming, I send them encourage them to come between class. I mean, if they're bleeding, if they're having a seizure, that's different. But there are some people who are just want a break. But any other questions, comments?
If they're choking and they lose consciousness, do you go for the AED?
Yes. And so if you're alone, I would start CPR. In this setting, we're not going to be alone, but yes, we want to add the AED in, because if we can't get that airway cleared, then the not breathing can turn into a cardiac issue. So there's a progressive algorithm, and then we want to have that available. All right, any other questions? Y'all know where my office is. Please come by. I have these little shields for your badge in my office. I meant to bring them with me. If you ever want them, they are a CPR shield. I hand them out because I gave CPR in the community, and it's not fun. Please use a shield. And these are really easy to carry on your badge, on your keychain. Cover you, unless it's your mama.